Hey guys, what's up? And welcome back to our channel. So today, we'll be talking about the most popular thing going on right now, COVID-19. And if you don't know what that is, you're probably living under a rock. Overall, coronavirus has officially ruined our lives, except for the tiny part that you get to stay at home. And if you're an introvert, you're probably having the best time of your life. But if you're not, it probably sucks. Basically, COVID-19 or coronavirus is a new virus that was recently discovered. Therefore, there is no vaccine to treat it yet. So try not to get it. The virus is a respiratory sickness. That means it affects the lungs and other parts of your respiratory system. If you're in close contact, which is less than 6 feet, the virus spreads through small respiratory droplets that were produced by the person with the virus when they cough, sneeze, or even talk. The droplets will land on the person in close proximity to the infected and can enter through the nose or the mouth, which will then be inhaled by the lungs. The coronavirus has an incubation period of up to 14 days, so people who are not showing symptoms can still spread the virus if they're infected. Warning signs in a person are difficulty breathing, persistent pain or tension in the chest, new confusion, failure to move, and bluish lips or face. There are many more warning signs, so if you notice any other signs in your family or yourself, call your healthcare provider immediately. To begin with, we need to understand how the virus affects the body. Broadly, any virus that enters our system takes control of the cells in our bodies and uses them as hosts. They then multiply and spread through our entire body. Since coronavirus is a respiratory sickness, it usually affects the lungs, inner lining of the throat, and the airways. Once the body notices the virus, the immune system begins to fight and sends antibodies and white blood cells to protect the body from the virus. Sadly, there are side effects of fighting off the virus. During the infection, white blood cells produce a substance called pyrogen, which causes fever. There are two categories of people at high risk of getting coronavirus: people who are above age 65 and people of all ages that have underlying diseases, especially if it is not treated or in check. These people must be extra careful. After getting the virus, symptoms include cough, fever, shortness of breath, muscle aches, sore throat, unexplained lack of taste or smell, diarrhea, headache, and in some cases it can lead to kidney failure, extreme respiratory problems, or even death. I kind of feel like a drug commercial right now. Anyway, the best way from dying or spending a lot of time in the hospital is by taking safety precautions. Wash your hands with soap for 20 seconds. Hand sanitizer with more than 60% alcohol is a good substitute if there is no soap available. Do not touch eyes, nose, and mouth with unwashed hands, and avoid being in close proximity to other people than those you are quarantined with. And if you go outside, stay 6 feet apart. Try not to go out for items other than essentials, like groceries. By taking these safety precautions, you could save up to or more than 45 lives. So if you ever want to be a superhero, you can pretend to be one by putting on a cape and staying back at home. In the end, virus outbreaks can be stressful times. It makes both adults and children fearful and anxious. To take care of your family and yourself, stay in touch by calling, playing family games online, or FaceTiming them frequently to make sure they're doing well. Thank you for watching. Like, subscribe, and comment on this video. Adios!